First of all, let me thank you all for joining us this morning, and Bara for putting in all the time and energy to put together this webinar. And the subject is back to school in the midst of this resurgence of COVID-19. You heard the heavy sigh there in the middle of my sentence. I am Catherine Reed, Director of Education and Content with the Association of Healthcare Journalists. Please feel free to ask questions during this conversation. We ask that you put them in the Q&A so our moderator, Bara Vaida, can pay attention to them and get them answered for you. Bara is our core topic leader on infectious diseases and a longtime journalist at the intersection of healthcare and policy, and is based in Washington, D.C. All right, Bara.
All right, thank you, Catherine. And thank you everyone for joining our webinar today. As Catherine was talking about, this webinar will be about reporting on COVID-19 as K through 12 kids return to classes, and the story is evolving as we continue to see the expansion of the Delta variant. And this is especially challenging with kids under 12 being ineligible for vaccination. And by the end of this week, or beginning of next week, I believe about a third of kids will be already back to school, and that will just be continuing through the month. And there, many communities right now are clearly uncertain about how to make sure that the classroom is safe and supportive of learning. And in about a dozen states, there are governors who have banned mask mandates, putting parents who are worried about what COVID in a really tough spot. And this is obviously a challenge no matter what age. So it's really great to have this set of presenters here today. You can put this topic into context and answer your questions. And joining us is Dr. Tina Tan, who is a professor of pediatrics at the Feingold School of Medicine at Northwestern University. She's a specialist in pediatric infectious diseases, and she's going to talk to you about the latest of what we know. And this keeps changing. We keep getting new data all the time. So really looking forward to hearing that update. And the next will be Robin Cogan. She's a New Jersey school nurse at the Camden City School District and the legislative co-chair for the New Jersey State of School Nurse Association, and she can speak to you about what she's seeing in her district and what New Jersey is doing, so give you some local perspective and also advice on what you can do to keep your kids safe this year in school. And we'll get the teacher's perspective. So glad to have you here, Daya Bilal-Threet. She is a senior policy advisor at the National Education Association. She's been handling COVID-19 policy for the organization, and she'll offer some thoughts also about how parents and teachers should be thinking about this in this coming school year and the Delta variant. Each of our guests will offer a short presentation and then answer your questions. You don't forget, so you can put in your questions into that little Q&A spot, and I will direct presenters to them. So let's get started. We'll begin with Dr. Tan. Tina, thank you so much.
My pleasure. Well, good morning, everyone. So I just want to give you a little bit of background on COVID in children, because I think there's been a lot of misinformation that has been circulating since the pandemic started. What we do know is that COVID-19 can infect anyone of any age, and that children do become infected and they can become ill with COVID. To date, there have been over 4.2 million children since the start of the pandemic that have been infected with COVID. This has resulted in almost 20,000 hospitalizations and over 360 deaths. So you can see that children do become infected and they can become seriously ill. We also know that at this point, there have been over 4,100 cases of MIS-C, or the multi-system inflammatory syndrome, that can occur in children. And one thing about this syndrome is it doesn't seem to matter how severe your initial COVID infection was. There have been children that have been asymptomatic or very mildly symptomatic, who then 3 to 6 weeks after that acute infection will develop MIS-C. We do know that in general, the infection in children is either asymptomatic or mildly symptomatic. However, there are certain groups of children that seem to be at an increased risk for having more serious COVID disease. And this includes kids under a year of age in any child that has an underlying condition. We also know that children that are in the Latinx and the African American communities also seem to develop more severe disease than children of other ethnicities. So the big question is always, how do we keep these kids safe when they go back to in-person school? And you know, as you've seen around the country, there have been multiple places where school districts are not imposing a mask mandate. And what we've learned from the pandemic over the last year is that mask and these other layered mitigation protocols do work. So in order to keep a child under 12 years of age safe, because none of these kids can be vaccinated, the staff and the teachers really all need to be vaccinated before they go back into the school setting. Everyone should be wearing a mask when they go to school. You should try and have some type of social or physical distancing where the desks are at least 3 feet apart. There should be good ventilation in a room. There should be good hand hygiene. You should try in very large classes to cohort the teachers and the students so that they are in smaller groups. Many places have gone to adding additional lunch hours so that the cafeterias are not so crowded, and you have smaller groups of kids in the cafeterias. There are also some schools that are having their students eat their lunch at their desks. So there's not so much mingling between the kids and between the teachers and the staff. There also need to be protocols in place, very much like last year, where if somebody does develop symptoms or someone is sick with COVID, then you know exactly what to do, and you need to work with your public health departments to do this. But one thing that needs to be said is that kids need to go back to in-person learning. We know that having been out of school for the last year, for the most part, has had a detrimental effect on many children. And they've really had a decrease in their academic progress, but also in their emotional and developmental development. And there are also a lot of services, as you all know, that are only offered in the school setting that many of these kids rely on, especially food. The other thing which we know is that over this last year, the pandemic has had a major negative impact on the mental and well-being of children, so that there has been a significant increase in the number of kids that have developed depression, their ADHD or other behavioral issues have gotten worse. And in the adolescent population, we know that suicidal ideations and suicide attempts have significantly increased over this past year. So we know the pandemic really has had some major impacts on that. The other thing which the pandemic has really impacted is the rate of routine immunizations in children. Over this last year, we've seen a significant decline in those kids that are considered up to date on their immunizations. And this is across all different age groups. So one thing that parents really need to be encouraged to do is really to get their children's vaccines up to date before they go back to school, because the last thing that we want is to have an outbreak of a vaccine preventable disease in addition to the amount of COVID that is circulating. Now, what we know about the Delta variant is that it tends to be more transmissible. And I will put this in context. So with the Alpha variant, which is one of the initial variants of COVID, one infected person could infect 2 to 3 susceptible individuals. With the Delta variant, we know that that's much higher, so that one infected person can infect 8 to 9 susceptible individuals. So you can see that that's a significant increase in the number of individuals that potentially could be infected. We also know that even if you are fully vaccinated, that this particular variant can infect you, and that you have the possibility of transmitting that variant to other people that are around you. So that makes this particular variant much more transmissible, with an increased possibility of transmission to other individuals, even if you're fully vaccinated. So that being said, it is really, really important that we stick with having kids and teachers wear masks when they're in the school setting. until kids under 12 can be vaccinated. This can also be a problem in the high school setting because we know that less than 50% of high schoolers are fully vaccinated. So you can see that still leaves a significant proportion of individuals in that setting who are susceptible to COVID. And the problem with that is many high schoolers are out and about in the community, unlike some of the younger kids who can't drive. So, this increases their risk for exposure to COVID, and then they're able to transmit it to the other people that are that may be able to get it. So
Quickly, Dr. Tan, can you,
Yeah.
when you talk about susceptible individuals, I'm assuming you're talking about unvaccinated, but maybe you mean another set of people as well?
So it is unvaccinated. It's people that may have been vaccinated but have immunocompromising conditions and may not have responded as well to the vaccine as a normal host would be. So, if someone has a grandparent that lives in the house that may have, diabetes or high blood pressure or heart problems, and the child is unable to be vaccinated and the child basically picks up COVID when they're going to school, they can bring it home to these individuals who are at higher risk for having complications if they were to get COVID disease. The other question that people always ask is, when is the vaccine going to be available for kids under 12 years of age? And right now, it looks like the earliest is going to be either at the end of this year or the beginning of 2022. So with that, I will stop and be happy to answer any questions.
Okay, great. Thank you, Tina. Well, next we'll turn to Robin, who will give us some of the local perspective.
Thank you so much. First of all, your information, Dr. Tan, was super interesting and helpful. And I'd love to look at some of the pieces. I was taking copious notes as you were speaking, because you spoke directly to what's not happening in schools. And that's what's really disturbing about returning to school. For me, and many of my colleagues across the country, there's about 95,000 school nurses in this country. But I want everyone to understand, for about 57 million kids. But I want to really stress that 25% of schools in our country have no school nurse at all. It is not part of the makeup of a school. Imagine that during a pandemic. 35% of schools across our country have a very part-time school nurse. So that's 60% of schools either have none or a part-time school nurse. The 40% where there is a full-time school nurse, the ratio between school nurses to students is astronomical. It can be 1 to 2,000 in a high school. Washington State, for example, the ratio is 1 school nurse to 4,750 students. So with those kinds of caseloads in the middle of a pandemic, which now has this, additional and very transmissible variant, we are looking at a very different return to school. Because last year, when we were getting ready to return to school, we had mitigation strategies in place that because of public health principles, we were hoping they were going to work. Now, what happened last year, I'll look at my school district as an example. I work in an urban rich community, and I say rich because it's rich with culture and diversity, but it is under-resourced. And my families were very concerned about the safety protocols that they were not sure were going to work for their students. We also had the opportunity to have a remote learning option. And so our school district initially did not return to school, because when we did an intensive survey with our families and our faculty, there was great concern about safety. And so we actually did not return to school until April of 2021. This coming school year will be the 3rd school year impacted by COVID. It started in 1920, in March of 20, we left our buildings March 18th. This is how little we knew, or little was being shared. We were told, don't worry, we'll be back within 2 weeks. We're gonna, what were they saying? Stop the spread, or there was some kind of, I don't remember what the language was at the time. So we packed up for 2 weeks. we were supposed to come back March of 2020. We came back March of 2021, and our high school students never returned. So our high school students have not been back in school since March of 2020. So we have tremendous barriers and obstacles in front of us. But that's not to say we want our kids back in school. When we returned last April, a large portion of parents did not still feel comfortable with their child returning to school. And that was before the Delta variant. I think what's different for us this year is that we know what works. When we were able to return to school, we had very little spread. We had very little outbreaks within the school. Now, of course, school is not bubble wrapped, right? So whatever happens in the community ultimately comes to school. This was really at the very beginning of the vaccine being available for adults. But what's concerning me most now as a school nurse is that what we know works is no longer being implemented, or there are barriers to implementing the very exact public health mitigation strategies that Dr. Tan talked about. You know, politicizing wearing masks, politicizing adults getting vaccinated, politicizing, physical distancing, pretending that this is any other school year is really gaslighting the people in our school districts. And it is very hard to wrap our heads around doing this safely when even remote learning is not on the table. So they want everybody back in school. We all want everybody back in school, but are we addressing what that means with the Delta variant? With the Delta variant, does 6 feet of distancing mean anything anymore? If everyone's masked? We don't know that, do we? No, we really don't know. You know, the other piece of it is when in my state, my governor, who I'm very fond of, Phil Murphy, he had one stance about masking, that it should be optional. Thankfully, the American Academy of Pediatrics came out with a statement saying masking, universal masking, regardless of your vaccine status, is what we are recommending. Governor Murphy paid attention to that, thankfully. And the CDC changed their guidelines too. It was kind of interesting that they were not coordinated, but that's another lesson, I think, to be learned down the road, that these messages, to really make them, I think, embraced by the public more, need to be coordinated. So now we are having masking in school. I'm thrilled, universal masking. It just happened on Friday. But what's not happening is the possibility for remote learning. So we are going to be back in school full. We are eating in school. That's the other thing I want to share. Last year, our kids did not eat in school. We provided meals. We had half days. We had 2 cohorts. So kids were going to school twice a week for a half a day. So there were A and B cohorts, and all meals were sent home. We're not used to feeding kids in school right now. If we are full in with no social distancing in the middle of a Delta variant, with kids who are not eligible yet to be vaccinated, yes, we're wearing masks. No, not during eating. And that's when much spread has occurred in past experience. What else do we need to do to keep everyone safe? I heard Dr. Tan talk about eating in classrooms. The fear that I have about eating in classrooms are for those kids who have food allergies, because they are at a different risk than other kids, because those allergens continue to stay in the classroom. There's more of a chance of sharing food when we're eating in small classrooms together. So there are like these nuances of things that I think about as a school nurse, because I've seen, anaphylaxis in school for the first time for someone who had an unknown, undiagnosed food allergy. I'm just, there's so many variables here. My big message, though, to parents and to school staff is please get vaccinated. That is what will take us out of this nightmare. Masking is great. We have to do universal masking. It's protective to a point, right? But it's not going to stop. If you're not vaccinated, it's protective, but it won't stop you from getting COVID. But if you are vaccinated and still have a breakthrough, you won't die. you know, you won't necessarily, hopefully, be hospitalized. I think, what is the data? Like 95% of the hospitalizations are unvaccinated people.
Even
So
higher.
is it
Even
higher?
higher. It's like,
99?
yeah, it's close to 99%.
99. So, you know, those are the things that I'm thinking about in terms of being a school nurse. If for health reporters, you know, if you're looking for things to ask families, I would ask, is there a school nurse in your school? And why not? And when it comes to testing, who's providing that testing? Because honestly, if you're that school nurse with 2,000 kids, how are we going to do that alone? You know, we're also doing contact tracing, reaching out to the health department. I mean, truthfully, every single school district, if we're going to do this right, needs a COVID task force. They need a public health person embedded in their school district to help handle this very difficult task, because in my state anyway, up to 70% of people who were contacted by the health department around contact tracing would not cooperate, you know? And the other piece of this, I mean, I could go on and on. I'm sure my time is up, but one of the other bigger super spreaders in schools are sports. There are sports that happen at school. There are travel teams. This is how these things spread. So what does that mean in terms of the Delta variant? You know, I am all for mandatory vaccine. You know, in New Jersey, it's probably very unusual in other states, but we mandate the flu vaccine for our youngest children because studies show that our youngest children bring the flu home every year to our oldest family members. So flu is mandated like many other vaccines across the country. Flu is just a little bit of a different scenario because that's not mandatory in very many states, but it has really helped us in New Jersey. I'm for mandating the COVID vaccine for staff, for students. That might not be as popular in my, you know, with my fellow NJEA members, but I feel like it's the vaccine that will save us. And what I understand, Dr. Tam, please correct me if I'm wrong, it's unvaccinated parents mostly that are bringing COVID to their children.
That's correct. It's the adults that are around the younger children that are giving them the COVID.
And when those children end up in ICU because of containment principles in hospitals, they may be alone. They may not have a family member with them. I mean, this is, if for nothing else, that message needs to get out.
All right. Thank you, Robin. I really appreciate that, the context you're providing for all of us. And next we'll turn to Daya. And just a reminder for the participants, you can ask a question in that Q&A box. If one, please don't hesitate to put your question in that box. Go ahead, Daya. Thank you.
Thanks so much, Farah. Good to be with you. I don't want to repeat the things that both Robin and Tina have said, because I agree with so much of what they said. So, you know, I think what I would add, you know, educators very much want to be back in schools. I'm a parent of a 5-year-old and a 10-year-old, neither of which can be vaccinated. Right. Yet I continue to be stunned, frankly, by the number of our members that aren't sure what their school's plan is. It has not been clearly communicated with them, even after all of this time and after all these resources have become available, you know, both as a parent, but also as an advocate, and certainly, you know, representing the teachers and educators that we do in K-12 schools and in college campuses all over the country. Collaborating, I mean, you know, the example that Robin just gave about the task forces, those have proven to be very effective. You know, even when schools have had to open and close and open and close again and again, the places that actually did that best had a plan. Parents knew what it meant to close. They knew that the school nurse, when she said green light, it meant come on back. When she said red light, it meant quarantine, right? For this number of days. They knew that who they would get their messages from. They knew what those codes meant. They knew exactly what to do. So they had the confidence in the plan and they understood it. More and more though, as we talk to our members and we survey them regularly, more than we ever have, we're finding that even though their readiness level is higher than we've ever seen, they are really wanting to get back. They're very concerned about plans and what they don't know. So, so much of this, it's like, this is like dieting. I don't know about you, but I've struggled with weight loss all my life. And I think that, most of us on this call could actually write a pretty good plan for someone else about what to do to lose weight, what to eat, what not to eat. The question is, are we going to do it? Right? I know I shouldn't have pizza and beer, right? Am I going to do it? Am I going to do it? What I know that I should be doing, and I think that's true, at the school level, at the community level, at the household level, right? Knowing what you need to do and doing what you need to do is what we're facing right now. And the vaccines, we've polled our members, we talk to them often. They are one of the highest vaccinated groups in the country. Over 90% of our educators are vaccinated. So they want to be back. They're demonstrating it every day, but they also know that they can't do it alone. They're heroes one day and the next day they're vilified. Same with healthcare workers, and we're also seeing in our conversations with them, more and more of them they're ready to go. They are being asked to do things that they feel are unsafe, that their districts are not preparing them to do, back into buildings that don't have the ventilation and health and safety protocols that they know they've been told repeatedly are not just important but essential, are critical. Because I think working for teachers and educators, you're always trying to learn a lesson. So for me, what are the lessons we're learning? These vaccines are highly effective. You could argue that the flu vaccine, 62% efficacy? These COVID vaccines are highly effective. They're more readily available. But we also are very concerned about the number of students that are not getting these vaccines and the overall perception of vaccine uptake and how important it is. We started to see this over the last couple of years with measles. So we're very concerned about the communication and the miscommunication that's happening, as Tina pointed out earlier. So one of the things we've been doing is, our members, teachers are some of the most trusted messengers in any community on any issue. And not only are they getting vaccinated, they're helping us communicate to families and parents. We've been training them, and we have our own ad campaign that really target parents to help them understand the importance of getting their students vaccinated so that we can all go back to school and do it safely. Because again, I think we know exactly what to do. Now I think we would take a more conservative approach, even to the CDC guidance around distancing, right? It went from 6 to 3 to do what you can, right? I do wonder if we had kept it at 6, would we be in a better position right now? And I think if Delta, one of the learnings from Delta is that vaccines are highly effective and it has to come with those other mitigation factors, because who knows what Epsilon and everything else after it will bring. It is not enough just to be vaccinated. It is the most powerful tool we have, but you have to have those other strategies, because if this virus has taught us nothing else, it is highly adaptable, right? And these vaccines are very effective for the variants we have now that we know of. So those mitigation strategies are going to be critical. It's why we have been encouraging our folks not only to get vaccinated, but encouraging them to collaborate and talk to their districts and be at the table as those plans are created, and not just with educators, but with families and community members. They're public health professionals, creating those kinds of equity task forces that Robin talked about. And, you know, they need more, schools need more supports, not less right now. Again, to Robin's good point, school nurses are case in point, right? Because while we all want to go back to school, and God knows for my 5 and 10-year-old, I desperately want them to go back. And, you know, my 5-year-old is going to kindergarten. He's never had a school experience, right? So health and safety first and foremost, but the effective learning strategies and accelerated learning strategies are also going to be critically important. And the behavioral components, the social emotional components that underlie all of that, you know, kids will come back into schools with a whole new array of behaviors, ideas, needs that are yet unknown. And so again, we are working with our educators to make sure that they're, you know, encourage them to get vaccinated. Again, they are already overwhelmingly so asking them to use their voice to talk to parents and get their children vaccinated, to do everything that they can, but you know, they can't do it alone. They shouldn't be asked to do it alone. And just again, these vaccines, it is not an either or, you know, vaccinate and then everything else can go, right? That cannot be the strategy. We don't know what these other variants will look like. It has to be a both and so I'll stop there. I know that folks probably have lots of questions, and I'm happy to answer those as they come.
Wonderful. Thank you so much. Again, everyone encourage you, please put your questions into that Q&A box. I'm going to start this off with just asking each of you. So I'll start with Tina and then Robin and then Daya. What can you talk to us about, Tina, what you've seen from the media coverage right now that's kind of bothering you in terms of this specific topic, return to school, kids, or, you know, kind of worrying you about how it's being covered and, you know, what advice and thoughts you have here?
I think the thing which bothers me the most has to do with sort of the debate around whether people should wear masks in school or not. I mean, that really is something that has become highly politicized, and people who say that, you know, it's going to be against the law to put in a mask mandate. I think it's ridiculous. I think people are not thinking about the overall public health impact that this particular variant can have. I think there is not any science that goes into individuals that say, oh, well, we're not going to require a mask, and parents probably should not put a mask on their children because it infringes on their right and they can't learn if there's a mask on, et cetera. So, you know, that's what bothers me the most, is that it's this misinformation that people are putting out there and not taking into consideration the health of all the individuals that this may affect.
Okay, thanks. And Robin, how can we do better?
Well, I have to say, from a school nursing perspective, you have all done amazingly well covering school nursing during COVID. We've never had more direct communication with health reporters ever, and the information being shared, I think, across the country has been really encouraging. And so I appreciate that, the fact that the work of school nurses has been spotlighted as a front line in COVID is really important. And you probably had your own barriers reaching us. And so I think it would be really helpful to have a conversation about what's the best way to reach a school nurse for any topic, but especially around this topic. And so I want to thank health reporters, health journalists for, you know, seeking out school nurses who then connect you to other school nurses. There's a lot of bridge building going on that is really encouraging to see, because we are the health expert in the school. We are the public health expert in the school community. And I feel like our voice has been valued in that way. And so I do appreciate that. In terms of the reporting, what I haven't seen as much, and I think it is worth talking about, is is what's happening in school districts where parents are fighting mask mandates, where the voice of the community based on misinformation, and may I say disinformation, because I think part of this is really very intentional to create chaos and confusion and division. I feel like that needs to be amplified, because it's very clear that vaccines work. It's very clear that the public health mitigation strategies work. And so when we, when we are not on the same team, that's when really unfortunate outcomes happen. We don't want to fight with parents. We're all in the same community. We want to be partners, and we want our children to be safe. So what is our underlying, shared value here has got to be children's safety, right? It's got to be children's safety. And I think what I'd love to see really amplified is, and to Daya's point, and it was an excellent point, schools have not been very upfront yet about releasing their return to school plans. And this was very much like last year. And it was because they were literally writing them, up until the night before, because things are constantly changing. Is that because they don't have a COVID task force? They don't have a public health person on their team. Last year, from what I'm hearing anecdotally, I don't have a study to support this, but my own experience and anecdotally hearing from colleagues, we were much more tapped in last year into the planning process. Not so much this year. And that really concerns me, because the Delta variant is a game changer. And so some of the released mitigation plans, return to school plans, look too much like 2020. Right? 2020 is not the same school year as 2021 because of the Delta variant. So can we address what we're dealing with in this moment? And what does that look like? And why do our plans look similar if they're even released? There's still a lot that is being left to the individual school district. And that is a concern.
Okay, great questions. And I think everyone we'll make sure to provide your contact information, Robin and Tina and Daya, for all our folks who are our members and who've been listening to this webcast. So I know many will want to be reaching out to all of you. Daya, if you could speak to that question I asked and some of the questions that Robin raised too.
Yeah, I think, it is overly politicized, sadly. I mean, and again, this didn't just start with COVID, again, measles, we've seen just so much disinformation about vaccines, their safety over the last few years. I think what would be really helpful is, not only talking to the folks that know, right? Like Robin said, people that are, pediatricians and school nurses and educators in classrooms that are having the experience. Talking to them is critical. Collaborating with them and listening to them, is critical. But I also think in terms of, reporting, and this goes to the point about disinformation, we've seen it. I'm sure you as journalists see it too. We as an organization, just over the past weekend, we were flooded with form letters, clearly an organized effort, about vaccines, just full of all kinds of disinformation about their safety, and not, mandating them, right? You're just full of disinformation and misinformation. So, there are these orchestrated efforts that get a lot of coverage, and there doesn't seem to be a lot of fact checking going on. Those things seem to get reported sometimes, and not by all news outlets, all are not equal by any measure, but those things seem to get just as much attention as Dr. Fauci, I mean, it's, yet those two things are not the same. And so, I think anything that, could mitigate against that disinformation is helpful. So not amplifying it, not lifting it up in the ways that I think I've seen it lifted up I think would be incredibly helpful because, you know, we have seen just orchestrated attempts to misinform people about the safety of these vaccines. And unfortunately, people are taking the bait, they're sharing this bad information, and, you know, it just ripples.
I mean, I think that's a challenge for all of us.
Yeah.
Most definitely. Should teachers be mandated? Should vaccines be mandated for teachers? I know you said you're really urge your members to do it, that most of your members are vaccinated, one of the most highly vaccinated group of people, but should they be mandated?
You know, that's a conversation that we are having right now with our leaders. You know, if it were easy to do, we would have done it. If that were an easy question, we would have done it. You know, one of the things there are several things, you know, we obviously want to make sure that that gets negotiated at the local level, right? What the accommodations are, what are the conditions for vaccine? Are you going to wear a scarlet letter that says you are? Who's going to enforce that, right? Is it going to be, what does non-compliance mean? We certainly want to make sure there are things like paid leave, you know, to give you time to get the shot, the side effects, right? All of those things really have to be discussed, and making sure that, again, as I said earlier, if you go down that road, and if a local goes down that road, we are fully supportive of what they've negotiated, and that they're at the table having that conversation. You know, but we also want to make sure that not only those things that I just outlined are discussed, but again, that those other mitigation measures like ventilation and school building readiness are not left off of the table, right? Because unfortunately, what I think can happen is employers will say, okay, everybody's got the shot, we're good, all right? We'll need anything else. If we're gonna put all of our eggs in this basket, we're good, everyone's vaccinated. That didn't work with flu, right? And it certainly won't work with this, you know, so making sure that all of those things are part of a conversation. And, you know, and again, as I said, you know, what does non-compliance mean? We know that educators are wanting to leave the profession earlier than ever right now. I think a lot of them are looking at this year as a defining moment, right? How schools open, what the plans are, what their working conditions are, you know, and I think this is going to be true for healthcare workers as well. You know, these are essential workers where we're starting to see severe job shortages, and that is no coincidence. You know, so I think, you know, we certainly don't want to do harm, right? You know, and create a backlash that, you know, leads to more people exiting or more people, you know, not getting the vaccine, you know. So, you know, talking to our members and our leaders is critical for us right now. That's exactly what we're doing. And again, there's no silver bullet, including the vaccine. It's not a silver bullet. Although I think we all would like that. That's just not the case. So we're having that conversation right now, Bara.
Just briefly, what % are vaccinated of your members? Would you say?
Yeah, our last survey showed 87%, and that was back in April. So we know it's well above 90 now. So yeah.
Got it. Okay, thanks. We'll move on to some questions in the Q&A. And again, please don't hesitate to ask your questions. First one here for Robin. How are your school nurse colleagues dealing in the states where governors like DeSantis in Florida are trying to enforce restrictions on masks in schools when they know the science and mitigation approaches?
I think the first word that pops into my head, but outside of furious, is demoralized. And my colleagues in Florida, I have some dear colleagues that retired early. This is not unheard of. I mean, how far can you push people who know the safest thing to do and are literally handcuffed and not able to do it? I mean, I just saw the last 2 days, there is a superintendent in one of the counties in Florida who implemented mask mandates. She immediately got a letter from, I guess, the Commissioner of Education, according to the governor, that her funding, including her salary, will be lost if she goes forward with this mask mandate. And she had until 5 o'clock yesterday to respond. I mean, these kinds of, you know, Orwellian, really scary responses from state government on to public health mitigation strategies. Just, in my wildest dreams, I could never imagine this happening. Public health, children's safety, number one, must center every decision that's made. And we have the tools. So to take those tools away from us, what is the point of that? Is the point to hurt people? Is the point to send children into the hospital? Because that's what is exactly going to happen. How do you function in a system that is intentionally inflicting harm on the children and the staff? I mean, that is what is going on. I can't imagine, a decade from now, looking back on this time and reading about what was done in states like Florida and Georgia and Arkansas and Tennessee, where the rise of children in ICUs is astronomical for lack of, allowing masks as a public health mitigation strategy. So in those same states and in other states, school nurses have been banned from contacting the health department. They've been removed from being part of contact tracing. These are the same areas that are basically like, oh, that was a really bad year, 2020, but we're done now. It's over, it's behind us. And they're moving forward with full open school, no masks, no social distancing, probably not really concerned about the ventilation, and, on to the next chapter, except it's not done yet. And that's where this you feel like you're being gaslit. You're working in a system wanting to be safe and securing and being responsible for thousands of people's lives, and yet your hands are tied. So my colleagues in those states, they're wearing masks. They're trying to model what is supposed to happen. I think the most disheartening thing, I think, is when school nurses are being really pushed against by parents and staff. Some staff feel like we're not doing enough, and some parents feel like we're doing way too much. And so there's incivility, there's just downright disrespect. I had a nurse say, I have been a school nurse for 25 years. How am I supposed to maintain my professionalism when the wheels are falling off the bus? For school nurses with decades and decades of experience, being told they don't know what they're talking about, being taken off teams that are safety related, we're at a critical point here for our own mental health, for the mental health of our staff and students. And the last thing I wanted to bring up is there's a grief component I don't think we've spoken about yet today. More than 40,000 children in this country, and it's probably more by now, have lost at least one parent to COVID. And for every person that anyone's lost to COVID, at least 9 family members are also impacted. So we're dealing with grief at a very deep level. We're also dealing with the fact that we as a nation have been in a collective trauma, a persistent toxic stress environment for like 18 months now. So yes, we have to focus on the mental health of the children, but we're also, as adults, trying to navigate these very treacherous waters and deal with our own grief and our own loss. So we need grace and we need space, because this is hard.
Okay, thank you. Let's move on to another question here. I wonder, how can parents and educators and other reasonable people persuade school districts to make the right decisions for the safety of everyone in schools? As you've all been talking about, the issue has been politicized. So how can safety advocates prevail in this arena? Daya, Robin, Tina, any one of you would like to answer? I think Daya.
I think everybody, as Robin has been pointing out, I think everyone has to work as a team, because a single individual is not going to be able to do this. But I think you really need to involve public health officials. You also need to involve maybe some of the local government officials, and really point out that this is all about the safety and well-being of everyone that's in a school setting. And that the pandemic is not over, And that unfortunately, the variant of COVID that is now circulating is much more transmissible. And you really need to have these protocols in place to protect everyone. Because Robin's right. I mean, you know, just speaking personally, seeing these individuals in the hospital and dealing with the parents and, you know, who have a very, very sick child, it's very difficult. And, you know, as a healthcare provider, it becomes more and more difficult because the last 18 months have really been very taxing on all of us. And, you know, I can't tell you when the pandemic will be over, but I think people need to recognize that it is not over and that we can't just go back to the way it was before the pandemic started, because that's not going to get us anywhere. And if anything, you're just going to increase the amount of COVID that is spreading.
Okay, so number one, pandemic isn't over. Robin, Dia, suggestions on what what can be done to help persuade school districts to make the right decisions?
Yeah, it is. I think, you know, exactly what Tina and Robin said. You know, the more folks that can come together and work with those school districts and those school boards. I mean, God, you've seen the school board meeting footage, right, in some of these places. The more parents and educators can come together as allies with communities to appeal to these school boards, to plan with these school boards, and to have the infectious disease professionals from these health departments engaged, because facts matter. Someone that can be a part of these conversations, that can set the record straight on, no, actually this is the case, right? To, you know, bring those facts to light so that evidence-based decisions can be made is critical. I think that, you know, all of that needs to be brought to bear, you know, with these school district conversations. And the other thing is, you know, we have the American Rescue Plan dollars, these ESSER funds that are available. There is stakeholder language, you know, that the U.S. Department of Education has put, has made a condition of the grants. 90% of that money is going to go to local school districts. It would support more school nurses. It would support increased improvements to your ventilation system, and so many of the kinds of things that we talked about here. Testing, the $10 billion that's available for testing. We haven't even talked about testing, which also is you know, optional in too many places right now, where it should be an essential part of the plan. You know, the conditions for those grants had stakeholder engagement for a reason. You know, now the degree to which that's actually happening, you know, varies widely, you know, across the country. But the thinking is right? The thinking is right. That is exactly what has to happen to advocate, you know, for school districts to have these plans in place. It's just critical. And those plans, once they are in place, they have to be communicated. People have to actually know what they are, right? Otherwise, you know, who are you talking to? Who's doing this work? So, you know, I think that's exactly what has to happen. I think the money is there. The right thinking has to be in the room about what's required.
Okay, I have two other questions. One, Dr. Tan, another infectious disease, and we talked a little bit about flu, but what about RSV? I'm seeing this as a concern that, given how much ICUs are filling up with, you know, unfortunately with COVID patients, there's a lot of concern about RSV this school season. Could you speak to that? And then another question is about, what's the best mask for kids?
Yeah. So this is an unusual respiratory viral season, in that respiratory viruses that normally occur in the wintertime have kind of shifted to now, primarily because kids weren't going to school in person. People were wearing their mask. And when many places just opened up, it allowed these respiratory viruses, which were in the community, to spread to other individuals. So with regards to RSV, it really is the youngest children that are at much higher risk for getting severe RSV, especially prematures. So not so much in the setting of a school, but more so in younger children or in children that may not have encountered RSV before, who have underlying conditions, they may be at higher risk. So yeah, it is a concern, but the vast majority of older children do not end up in an ICU setting with an RSV infection. The best mask for children is not N95. The droplets that most people generate in a community setting are the large droplets. So a cloth 2-ply or higher mask probably works as well as an N95. And that's what I recommend, primarily because it's more comfortable and it's breathable. And you basically want children to be comfortable so that they keep their mask on for the majority of the day. And children 2 years of age and older, we know over this last year, will wear a mask and will keep the mask on. It really is more the teenagers that we worry more about, because they're more likely to take their mask off, to socialize outside the school setting, to get COVID and to bring it back to the school. So a mask that's a cloth mask, 2-ply or higher is the best mask for kids.
Thanks, that's really helpful. And we only have a couple of minutes here. And I know, Robin, you touched on this a little bit, but who are the stories that we're missing? So whose stories are we missing? What voices need to be amplified? I know each of you touched on this just a little bit. Love to hear a little bit more, Daya, your thoughts. Tina also, and Robin again.
Yeah, I think the stories that are missing are the voice of the students, the voice of the families. I think their voice needs to be amplified. What they would like to see, what are they comfortable with? What would make parents most comfortable to send their children back to face-to-face learning? And what has it meant to go through this time, right? I think there's so many lessons that we're going to learn as individuals, as school communities, as a wider community. And so I would love to see the voices of our students and families amplified. I think that would be very important and helpful, and humanize this. This is not all about institutions. This is about people and children, and our most treasured, population are our children and our most vulnerable. So yeah, I would love to see that.
Daya.
Yep, I would agree with that. And I would say, families and parents of color and in rural settings. You never hear enough from families in rural settings who don't have access to, great healthcare and hospitals and the infrastructure that some of our more fortunate districts have ready access to. How are they making decisions? Most school districts are surveying their parents right now to ask them questions, or should be, right, if they care what the parents think. So I think that that continues to be really critical. And of course, our educators and our educators of color in hard to staff schools, and those who are serving students with special needs, I think are on the very precipice of all of this. What they see and are navigating with our most vulnerable students, it is a lesson for all of us. So I think that they're critical to be heard from right now.
I think Daya and Robin hit it on the head. I mean, I also would include maybe looking at some of the Native American students, because earlier on, we saw that on many of the reservations, they really had some of the highest COVID rates all over the country. So yeah, I think, really pointing out the struggles and the needs that these individuals have would be incredibly important.
Thank you all so much. We're just about out of time here. Thank you for such an informative and interesting conversation. I think we got a lot of story ideas here. And as I mentioned earlier, I think all of you are available to speak to our members further about this. And so I wanted to just, thank everyone who tuned in today or who are watching the recording now. HEJ will continue to bring you webcasts on a variety of health topics, particularly COVID here, as a part of your membership. And this webcast and all others will be archived on our website. So thank you all for joining us today, and wishing you luck with your stories. And thank you again, Tina, Robin, and Daya, for your time this morning. Really appreciate it.
Thanks for asking. It was an honor to meet everybody.
Happy
Yep,
to be
same here.
Thank you very much. That was wonderful.
Thank you, Catherine.
Thank
All
you.
right, everyone take care. Boy, take care out there.
Be healthy.
Yeah. Thanks, Bara. I'm gonna end it.